Hello, I'm here with Shikha Pillai, who's from Siemens Healthcare, and she's been telling us earlier about the role of industry in terms of cardiovascular and environmental sustainability. Shikha, what do you feel, given the role of medical industry in terms of cardiovascular medicine, what do you feel are the barriers and responsibilities for industry in terms of environmental sustainability?
Yeah, I think as industry, I think we're very conscious about the role that we have. Right? We are really working to address life-threatening diseases. We are advancing technologies to enable early diagnosis and comprehensive care and enable more patient outcomes. But at the same time, we are contributing to environmental impact. And I think this is, therefore, what we see as our responsibility. And I think we are accountable for that. And we really need to look at not just how we create environmental impact out of our own operations, but I guess the biggest challenge for us is the value chain. And a lot of this is what we cannot control, but we then look at areas where we can influence our value chains. And this would mean looking upstream. How do we work with suppliers? And talking about barriers, for example, we are working with a huge host of suppliers across the world. So to be able to then steer suppliers towards better impact and to drive actions in the area of environmental sustainability is quite challenging. The other area is looking downstream, how our products are used. And of course, here it is for us as a company that builds products and that has long product life cycles. It's very important for us to embed all these actions early in terms of product design and then steer how we design, manufacture, and how customers use our products. And of course, it also then requires quite a lot of collaboration and building data, building standards, and then jointly working together with suppliers, customers, and also at a sector level to drive our responsibility towards our goals, but also overall land better care with much less environmental impact.
That's really interesting. And you speak about that sort of broader sort of ecosystem when it comes to medical industries. You've got upstream suppliers, you've got downstream customers. What levers do you pull to try and influence them in terms of environmental sustainability?
So looking upstream, I think we have established a very comprehensive, well-working supplier engagement program. And this requires really very close interactions with suppliers, setting up mechanisms to collect data from suppliers and also motivate them, even to the extent of training and holding workshops with suppliers to drive effective actions towards environmental impact reduction and lowering our footprint. But there's also other mechanisms in place. For example, in our own design development product life cycle, we also try to embed environmental sustainability into decision making so that we can then drive more environmentally sustainable product outcomes. And of course, with customers as well. I think the broader ecosystem, it just works on collaboration. What's good is customers have goals. So we are also able to then show how our efforts are then directly lined up to support our customers in meeting their goals.
Yeah, absolutely. And I guess that sort of comes back to the idea that if we as clinicians and sort of the broader healthcare system prioritize environmental sustainability, then that puts additional drivers onto medical industry around that.
I think what we do see is there is a lack of awareness. And I think, of course, at the end, we don't expect every doctor to be thinking sustainability. I think at the end, doctors have to think about patient impact, about clinical impact, about advancing, for example, cardiology. But I think it's important to also know that sustainability is not this lofty goal out there much later that you need to look at. You really need to do small steps. And with every step that you make in terms of how you make your practice efficient, how do you design actions around, for example, using equipment more effectively. I think there's a lot that you can do, and we can also then work jointly to create models that are then scalable, repeatable, and also then benefit the overall pathway.
Yeah, absolutely. I mean, and I think it's everybody's responsibility, as you say. It can't just be that lofty goal. Thank you so much for speaking with me this afternoon. It's really appreciated. Thank you.